Jaw swellings. Classification of jaw swellings into Epulis. First of all, Epulis is any swelling related to the mucoperiosteum of the gum. It includes fibrous epulis, myeloid epulis, granulomatous epulis, and malignant epulis. Malignant epulis may be sarcoma or carcinoma. Also, there are odontomes. Odontomes are tumors or cysts related to the remnants of the development of teeth or related to the sepsis of the teeth. Odontomes include dental cyst, dentagerous cyst, and adamantinoma. In addition to epulis and odontomes, there are bone tumors, which may be benign or malignant. Bone tumors include osteoma, chondroma, giant cell tumor, which is osteoclastoma, sure, we all know from orthopedic. Malignant tumor may be osteogenic sarcoma, fibrosarcoma, or metastases, or malignant tumors of the maxilla. First of all, we will discuss Epulis. We said that Epulis is any localized swelling. Any localized swelling related or on the gum may be one of the following. Epulis, which is any swelling related to the gum, may be fibrous epulis. Fibrous epulis is the commonest type. It is due to sepsis, irritation of the gum by carious tooth. This leads to localized inflammatory hyperplasia in the submucosa of the gum, with formation of a fibrous mass covered by hyperplastic mucosa, covered by hyperplastic squamous epithelium. Therefore, there is dental sepsis, carious teeth, produce in the gum localized inflammatory action with hyperplasia of the tissues in the submucosa of the gum, with formation of excessive fibrous tissue covered by hyperplastic squamous epithelium. We all know that the outer part of the oral cavity and the tongue is covered by squamous epithelium. What is the clinical picture of fibrous epulis? Fibrous epulis is painless, very slowly growing, pale red or white. Why pale red or white? White is logic because it is a fibrous tissue mass. Pale red is also logic because this white fibrous tissue mass is covered by mucosa, which is red in color. Therefore, it is pale red due to presence of the covering mucosa, or white due to the fibrous tissue. It has a pedicle. It is pedunculated, smooth. The consistency is the consistency of fibrous tissue, firm in consistency. And doesn't bleed on touch because it is not vascular and covered with epithelium, and it is related to a carious tooth. What is the treatment of fibrous epulis? The treatment of fibrous epulis is treatment of the cause, treatment of the affected carious tooth, then complete excision with wide base related to the mucoperiostrum of the gum, because here the mucous membrane covering the gum is closely adherent to the periosteum of the underlying bone, therefore it is called the mucoperiostrum. Therefore, excision of this fibrous epulis with a wide base of mucoperiostrum. This is the first type, which is the commonest type and called fibrous. Less common types is giant cell epulis or myeloid epulis. I prefer giant cell epulis. Why? Because it originates from the giant cells. What are the giant cells related to the mucoperiostrum of the gum? Osteoclast. Osteoclast of the bone of the mucoperiostrum proliferate and form this swelling. Therefore, it is a giant cell tumor arising from the osteoclastic layer of the periosteum. The periosteum, we should take care that the periosteum containing a layer of osteoclast, another layer of osteoblast, and another layer of fibrous tissue. Therefore, from the fibrous tissue of the periosteum and the submucosa of the gum arises the fibrous epulis. From the osteoclast of the periosteum arises the giant cell epulis. Histologically, there are giant cells which are osteoclast with thin-walled blood vessels, and osteoclast and this thin-walled blood vessels lies in between fibrous tissue stroma. What is the clinical picture of this myeloid epulis? Painless, but rapidly growing, highly vascular. Therefore, it is characterized by its reddish blue color. Sessile mass has a wide base, not has a pedicle, which is narrow base. It has a wide base, therefore it is sessile. Soft swelling. Because it is highly vascular, during examination it bleeds on touch. Since it arises from the periosteum of the bone, therefore it is fixed to the bone. And the related teeth, the swelling push and displace the related teeth. Therefore, the related teeth becomes displaced, separate, and maybe becomes loose teeth, and falling of teeth may occur. The treatment is excision with wide safety margin of the underlying bone. The third type of epulis is granulomatous epulis. Granulomatous epulis is septic granuloma. Is septic granuloma related? Why septic granuloma? Due to sepsis, carious teeth. Therefore, there is a septic granuloma related to a septic tooth, carious tooth. It is a mass of granulation tissue, blood vessels, capillaries, mass of granulation tissue and connective tissue with inflammatory cells without epithelial covering. Therefore, if you touch these capillaries, sure, bleeding won't touch occur. Clinically, this is a painless or painful. It is inflammation. There is inflammation and inflammatory cells related to carious tooth. Since it is inflammatory reaction to this septic tooth, therefore it is painful. Very slowly growing. Blood vessels red in color and the presence of pus. Therefore it is yellowish red in color. Soft in consistency, lobulated swelling. Bleeds on touch. The related teeth are septic carious tooth. Due to presence of inflammation, the inflammatory bacteria, the bacteria pass in the lymphatics leading to non-specific lymphadenitis, which is sure, firm, mobile, tender lymph nodes. The treatment is excision with diathermy, with treatment of the related carious tooth. The last type of epulis is malignant epulis. This is the malignant epulis. Malignant epulis may be carcinoma arising from the mucous membrane, which is stratified squamous epithelium. Therefore, it is squamous cell carcinoma of the gum. Or may sarcoma. Sarcoma, usually paraosteal fibrosarcoma, arising from the outer fibrous layer of the periosteum. Clinical picture as any malignancy: hard, rapidly growing, irregular, ill-defined, sessile mass or malignant ulcer, ulcerating mass, sure fixed to the underlying bone, and the swelling when enlarged will push and displace the related teeth, leading to loose teeth. The lymph nodes there may be metastasis. Therefore, the lymph nodes may be enlarged, hard, first mobile, and later on becomes fixed lymph nodes. Sure, malignant epulis needs investigation. Biopsy is the sure diagnosis, plus CT scan to detect the size and the extent of the tumor, plain X-ray to show the affection of the underlying bone. What is the treatment of malignant epulis? As any malignancy in the head and neck, treatment of the primary and treatment of the secondaries. Treatment of the primary is sure radical resection. If malignant epulis occur in the lower jaw, hemimandibulectomy with mandibular reconstruction. Management of lymph nodes. If there is lymph node positive, therefore mandibulectomy will be associated with modified neck dissection. What is the name of the operation of mandibulectomy with modified neck dissection of malignant lymph node? It is called commando operation. In bulbable lymph node, if the lymph nodes are not bulbable, close follow-up. Close follow-up and they no prophylactic neck dissection, except if large tumor, poorly differentiated tumor, or difficult follow-up. Sure, in inoperable cases, palliative chemo and radiotherapy, palliative resection. These are the epulis. Thank you for good listening and good luck.